About 10 years ago, I was approached by a person in his mid-30s who was told me that he thought he had been injured by chiropractic manipulation. It's a cervical manipulation when a chiropractor adjusted his neck. And I started talking to him, and he told me that he suffered a stroke from that. I did a little research, medical research, and found out that there was a lot of evidence or a lot of literature about this phenomenon. In fact, it had even been given a term, chiropractic stroke. What he had happened to him was not that unusual, unfortunately, and proceeded on with litigating that case, resolved it in his favor. Over the next several years, 4 or 5 other people with very similar injuries called me, and in fact, after talking to their neurologists and neurosurgeons, it became apparent that their strokes too came from this cervical manipulation. So I did a lot of research, talked to some of the experts in the field who had written peer-reviewed articles and done studies on this, and I found out that quite a few people having cervical manipulations performed by chiropractors suffer this chiropractic stroke type injury. And basically what it is and what we use to show the jury and demonstrate the injury are several. I've got a anatomical diagram that we use to show a jury exactly how this happens, and it's fairly easy to see. What you have here is in the model demonstrates there's a red line going up, which is the vertebral artery. The vertebral artery carries blood to the brain, and when you have a cervical manipulation, the chiropractors typically perform a rotational twisting of the C1 vertebra. The vertebral artery goes in a vertical direction up until it hits the C1 vertebra, and then it takes a horizontal direction before it meets up with the spinal cord and goes into the brain. These diagrams demonstrate, as does the anatomical model, that the vertebral artery goes through the wings of the vertebral bodies until they get to the C1 area where it takes a horizontal turn. And as this diagram shows, the rotational twisting tugs on the vertebral artery enough so that it injures the artery. Now, this injury is not such that the artery is totally severed. The inner lining of the vessel, of the vertebral artery, gets a small tear in it. And over time, the body's natural defense mechanism is to try to repair the injury in the vessel by piling up platelets on the injury, as this depicts. So over time, and sometimes it takes days or even up to a week, but over a time of platelets piling up on the injured vessel, the person can have a clot, which totally occludes blood flow to the brain. So that is how the stroke, it's called an ischemic stroke, because blood flow is cut off to the brain, and the person usually suffers what's called a brainstem stroke or a pica stroke. We've had clients who have had almost full recoveries from this injury. We've had clients who died within days of having the chiropractic manipulation. So like any stroke, you can't predict the final result oftentimes, but it's a terrible injury, and it's one that I think the public does not have a full awareness of. And typically we found with our 5 or 6 clients who've had this injury, they were never given any informed consent by the chiropractors. After talking to various medical doctors that treat patients with this injury, the neurosurgeons and neurologists, they tell us that simply the risk versus benefit of a cervical manipulation never weighs in favor of having a cervical manipulation. So people go to chiropractors thinking they're going to come out feeling better, and sometimes that's the case. But the physicians that we've talked to and discussed these that have seen many, many patients with this injury tell us they would never, ever, encourage a patient to see a chiropractor for cervical manipulation. If you were to poll the general public, I think you would find that most people would not in a million years dream that they could have a stroke from chiropractic manipulation. That is not true. We find that they are much more prevalent than even the medical literature shows, because we've been told by neurologists and neurosurgeons who treat people at the emergency departments when they come in for a stroke that unless a patient voluntarily suggests that they've recently been to a chiropractor, it never gets into medical records that it's close in time to the cervical manipulation.